I've been really lucky that my whole professional career has been in healthcare, and I was never in direct care delivery, but I worked on issues related to making sure patients got access to cancer drugs. My mom had cancer very early on, and we were always so thrilled she'd overcome it. But at the same time that her cancer came back, I was doing a project on oncology care for patients, and I got to meet Kim and other members of the cancer support community. And it just seemed like this amazing collision between my professional career and this amazing opportunity to be on the board of the CSC, and my mom actually needing to take advantage of some of their services. And the exact same day my mom finished her treatment, my mother-in-law was diagnosed. And my mom has luckily survived and lives with us and causes a lot of trouble. But unfortunately, my mother-in-law succumbed, and we had to really lean heavily into Kim personally and other members of CSC, particularly on those issues related to when and how to go to hospice and how to have those difficult discussions. So to have this amazing opportunity to join CSC and get to learn about the organization from a high level while experiencing their services at the same time was truly remarkable. I actually was not familiar with CSC until that fateful day when we met each other. And when I got to work with them, I was shocked, and I thought they were so unique because they represented every type of cancer and they were only focused on the patient. And they actually collected data on what patients needed. And so few organizations do that.
We realized very early on in this crisis that cancer patients were among the most highly impacted by COVID-19. That led us as an organization to realize that we needed to act quickly in order to respond to the needs of those we are already serving, but frankly, to the needs of thousands of other cancer patients across the country to whom they could turn for help or support or guidance. We really pivoted, I think, very quickly. Within 2 weeks into the crisis and the shutdown, we were reaching out to corporate partners, foundations, individual donors to let folks know that even though we were in this health crisis and eventually economic crisis, we as an organization felt the need to step up. So we launched an emergency fund to raise the dollars to be able to enhance our services, increase the work that we were doing to support cancer patients. As the head of the organization, I really thought quite a bit about how I wanted to lead through this crisis and how I wanted to lead during this time. But certainly I think it also challenged me to think about different ways to support my staff and to connect with my board of directors. How can I empathize with folks who are really struggling during all of this? We're all struggling. Our folks are scared about the health impact for us and for our families, and worry about the economy. How do you empathize with people? How do you engage people in that conversation and give them a good, safe space where they can talk about what they're going through and what their struggles are? In addition to challenging us as an organization and challenging our mission, it also challenged me, I will say personally, as a leader. And I really looked for some ways and continue to look for ways to lead through this crisis, through empathy, through engagement, through motivation, and through gratitude. So I think that one of the lessons, certainly for me, and I think for us as an organization, is that we have to redouble our efforts to reach out to the underserved and to reach out to those who are marginalized in our society and who have, to me, every right to have equal access to healthcare and equal access to the resources that the rest of us have to manage through this crisis. I think we have certainly learned that our mission is really central to the cancer experience. We talk about this idea that psychosocial care, that support and navigation is as important as medical care in the face of a cancer diagnosis. But I think that core idea and the core need to support the whole person and the whole patient has only been really pushed forward to the center when it comes to COVID. It has really highlighted that we have to take care of the whole person.
2020 may have tested us tremendously, but I think it also just shored up our core even that much more. And I think it allowed us to get to a new plateau that we're going to just be able to jump off from and exceed in so many ways. And so many of our initiatives that we never thought would advance so quickly, I think are really going to be accelerated.
We have a lot of great things happening. You're going to see a lot more digital tools and resources from the cancer support community. You're going to see more online groups. You're going to see more services and resources online, particularly because cancer patients are still going to be limited in their ability to get out and about, particularly in light of COVID, which is still a real issue for us and will continue to be for some time. So you're going to see a lot of more fun and interesting and interactive digital tools and resources for patients. You're going to see a lot more activity from our policy team around access to care, around folks' ability to afford care. We're really continuing to fight in Washington, D.C. and at the state level to ensure that folks do have access to the highest quality care, because certainly we believe that everyone deserves that type of access to high quality health care. You're going to continue to see great work out of our research institute. We are very committed to ensuring that the cancer patient voice is included in every conversation where decisions are being made about cancer patients. And I just want to thank all of those incredible donors, thank them for all they do to support our mission. I also want to emphasize that there is more to do. I want to emphasize that there are still so many unmet needs, that there are folks who are really struggling, folks today who maybe they haven't even heard of the cancer support community, and maybe they'll hear about us tomorrow or the next day or the next day, and they're going to need our support. They're going to need our services, our education, our navigation services, and we want to make sure that we have the resources and the team to be there to support that person and the next person and the next person.